I woke up face first on the ground and saw the blood. So I immediately was like, something has gone wrong, but I didn't even know what at that point, because it was kind of like whether it was my nose or my mouth. It was like kind of just a pain all over my face. So it was mainly shock, and it was really scary. It was the summer of, I think, 2022. I was on some medication at the time that lowered my blood pressure, and it turned out it lowered it more than we had kind of realized. And I was making breakfast that morning and I started to feel a little dizzy. I woke up suddenly on the floor, and there was a lot of blood everywhere, and I was like spitting out pieces of tooth from my mouth. The majority of the tooth had actually moved up towards my nasal passage, and it was just the very tip of the tooth that had broken, and those were the pieces that I felt in my mouth. Went to the dentist later that day, and they removed the tooth.
Leah came to us and she had her front tooth replaced with a large bone graft due to a large amount of bone loss secondary to an infection. We grafted the site, it healed extremely well, and we placed her implant. She's really happy with the results and it looks unbelievably natural. We also removed her wisdom teeth, so she had a lot of work done with us and she had a really, really good experience because we utilized a lot of our technology and techniques to give her really good outcomes and also a really nice post-operative course.
It was definitely like something I was a little insecure about, but I just was like, I knew that if I just saw everyone that I knew immediately without the tooth, then any questions that people had would come immediately and I could kind of like get them over with. Everyone here was really welcoming, and the thing that really stuck with me was up until that point, all of the dentists and the people at the ER who I had seen, they were all like, oh my God, this is crazy. We've never seen anything like this before, which is not the most reassuring thing to hear. And so I really remember that my first appointment here, the doctor told me, I want this to sound reassuring that this is actually like a normal procedure for us. It was very comforting to feel like it was someone who had dealt with these types of situations rather than a dentist who's like, oh my God, that's crazy. It feels like this office focuses on the kind of procedures that normal dentist office may be considered to be fringe cases. And so I think that for anyone who's going through some kind of dental emergency or an unusual trauma to their mouth, coming here really makes you feel like these are people who are 100% capable and used to performing those types of procedures.